What is up, everybody? Welcome back to another edition of the Run Your Mouth podcast. We are joined by a fan favorite, an old classic, Dr. Crimm, rocking a new look. Rocking, you know what this look is? This is the rock star going back on tour. Took down the long hair, cleaned it up a little bit, aging
Yes.
gracefully. How are you, Dr. Crimm?
I'm doing great. How are you, Robbie? Thanks for having me.
Absolutely. And guys, if you're out there, we got big time porch tour dates coming up. I hope Dr. Crimm maybe will come out to Bethlehem, PA. I think that's the closest to you because we're going big weekend. Bethlehem, PA, Pittsburgh, Richmond, Virginia, staying on the road, Raleigh, North Carolina, going to Austin. I'm going to be out all of July. I am looking forward to it. Dr. Crimm, let's start with this. Bird flu. Are we all going to die?
I don't know. It's funny. I don't think not funny, haha, but funny, interesting how it all ties back into a COVID. So I did some prep for this and was looking through stuff. And there was a Dr. Redfield. Have you heard of him at
Yeah,
all?
he's the CDC guy who basically seemingly got forced out by Fauci
Right.
when the lab leak thing first happened. He was like, "Hey, I think this was out of a lab, but don't worry, I'll just leave the CDC. It's okay. I'll just go into
Yeah.
private practice."
Right. Yeah. And so he gave this sort of little talk on it that was somewhat illuminating. So the likelihood of it spreading, I mean, it's possible if you're a farm worker and you're around it a lot. There has been some animal to human transmission. There's only been 3 human cases this year so far that I'm aware of. But what he was saying is that they've done gain of function research on it, and that they basically mapped out how to make it so it's transmissible to humans, and the how to do it is out there in the ether so that anyone with the knowledge and ability to do gain of function research could just make this a virus that could spread. So
So was he? Because when I saw his thing, he sounded. It's like a week ago, he was the level headed guy who left the
right.
CDC, and he's kind of been out there going, "Hey, I think this was a lab leak." And then he was quiet for a while, and then he's been talking about how he's been treating private patients and doesn't love the vaccine that they threw out with the mRNAs in it. He seemed like the level headed guy. Then this thing was going on, and the latest piece of information from him was like, "Yeah, this could get real bad and be real deadly." But then I've read other articles saying that this seems slightly even. I just skimmed the Zero Hedge article that was saying it almost seems manufactured because now they're testing more for it. So whenever you start testing more for it or using PCR tests, you're going to see an increase. And so we might not actually be looking at that much of an increase, and that it hasn't yet jumped to humans. So this is new information because you're basically saying that he thinks that someone's going to actually transition the virus. Who would want to do that other than if you're going to put on your most evil hat that the
Right.
pharmaceutical companies either want to cull the population or have a vaccine ready to go, and so they specifically want to roll out a virus, which we've never gone that far down the rabbit hole of evil on this show. We've said crazy things and we understand those possibilities, but I don't think we've ever gone that far with the COVID claims. Who does he? I don't know. What's the theory there? Who does he think
So
would?
I just from the little tidbit that I got, I don't think he says or states that anybody specifically would do such a thing. He just says that the possibility exists for to make it more highly transmissible to humans.
How
So
often? How often do viruses make the jump from, I guess, animal only viruses to animal to human viruses?
I mean, you're asking me a question I don't know the answer to for
Oh,
that,
okay,
to
fair
be
enough.
exactly honest. But I mean, obviously, things have to start somewhere. And so, whether it's bacteria or whether it's viral, getting it to be a virus to be more virulent or a bacteria to be more transmissible or make that jump, it's always possible through nature slash evolution. But it doesn't happen overnight.
It
So
does. I guess if I'm just gonna put on my wild ass conspiracy hat and wonder what the agenda with avian flu could be. So it seemed with COVID that they were hoping for health passports and that they were hoping to be able to full time track us through our phones and claim that that was going to be a health passport. And it seemed like they weren't quite able to get that agenda done. if I were to
Mm.
say theoretically, what do I think their avian flu agenda could be or might be? I would say I start looking at Thomas Massey talking about how they don't want you to be able to have your own farm and to be able to raise your own cows and just be able to sell it to other individuals. And I could definitely see a framework, I guess, for larger regulation of the food markets on account of the avian flu virus, or even getting rid of large amounts of food to try and transition us to alternative food sources that maybe they've invested in, such as bugs or otherwise. But I don't put a lot of weight onto that they're looking to execute this plan, or that they'd successfully pull it off.
Yeah, it'd be. I would think it would be. I mean, I guess if you're going absolute total quote a conspiracy theory, or you could envision something like that happen, sort of like you know Andromeda strain or whatever type style. But yeah, obviously, could it eventually become transmissible to humans easily in nature? Yes, of course. But his when I listened to him speak, he was saying that the more likelihood for that to become like in the next couple years for it to actually make a jump where it's more virulent and more transmissible to human beings would be someone who would have to actually go in and do that, make the changes in the virus. So.
And how do you? I mean, I don't even know where there have been the most cases of avian flu. Is it like out in China thing, and we can't control it because they don't have the best standards for caring for cattle? Is it more South America? Is it because we factory farm over here? Like, what are kind of the prime conditions? Like, you can tell me, hey, if you leave open water, you're gonna end up with more mosquitoes. You can end up with malaria. What are like the prime conditions that kind of potentially facilitate more even avian flu, I guess, amongst cattle?
Well, for anything, it would be sort of overcrowding. So going back to what you were saying about sort of factory farming, right? So even in animals. So if you take a bunch of human beings, right, we have a meningitis vaccine, and who do we use it on? So that vaccine specifically, let's say meningitis B, we use that. Like see that in the military, or where people are put in close quarters in large groups, because then the concern becomes if someone gets it's more like to spread, right? So it's the same thing, I guess, with a cattle herd or a flock of chickens, or so that the more dense that population that you're around, the more likely to spread within the animals, right? So if one gets it, it's more likely others to get it. Same thing in terms of transmission to humans. Most of the cases I think that they've seen have been in people who are farm workers, so people who are around these animals all the time. I don't know specifically of any cases going from farm worker to someone else.
And that's when it starts getting scary. If you got a farm worker working on a factory farm, he somehow gets the avian flu, and then he transmits it to another human. And then when that happens, we got to start killing farm workers.
Yes. Yeah. Strange.
Now, I'm just curious. It's amazing how much research and reading I did through the COVID shenanigans. And this is sparking all sorts of questions. But is there even a way to maintain these things once they make the jump? Like, if you've got, I know what was so odd about the COVID virus was kind of, I guess, how easily transmissible it was. And that's partly why people so thought that it must have been made in a lab. But if you get something like an avian flu, once it makes that jump to humans, so I guess, like, if you manage to catch the first humans, are you able to isolate it and then we never have to deal with that again? Or, like, once that kind of pops into the ether, it's like someone breaking the 5-minute mile. Like, it's just something that happens. It changes in our reality. People do it, and then it becomes like a known thing that you can do. And then it's just kind of like almost like the way technology develops, and then you just have better technology and go from there.
So you're saying what happens to the virus? How does it
Yeah, I'm saying once it evolves, like, let's say you capture it with the first 3 people. Or let's say we got ahead of this and we said, you know what, we're going to test every farm worker before they leave the farm areas. Like, is there a way to contain viruses once they mutate, or is it kind of like unless you capture it right away, it's cat's out of the bag and it's just going to rip through humanity?
So, so viruses in general, or let's go back. So that depends on two things. One is how virulent a virus is, and two is how deadly a virus is. And usually, viruses are one or the other, right?
Right.
So, even though viruses aren't quote on live, they want to survive, right? So that's nature, right? It wants to spread, it wants to have a host and find a host. So in order to do that, it needs to become virulent. And so the more virulent it is, the more likely it's spread, the more likely it's going to survive. Versus something that's very deadly, like let's say Ebola, right? You'll get a certain containment of Ebola because it's very deadly. So it's because it kills quickly and easily, you don't see so much spread of it because the host of the virus dies, right? So if the virus is too deadly, it's not going to spread because it's not going to get to that phase in your body where you can pass it on to somebody else. So then the question you were asking is, can you contain it? Well, it sort of depends on how virulent it is, right? So one of the things I always found interesting with COVID, like, so when they were in the thick of it, right, they were like, wear a mask, this or that, all that stuff. But in general, like, you have protections in your nose and in your mouth. What are we not protecting? Our eyes. So we have natural protection, natural barriers if the virus is coming in through here. We don't with our eyes. How do things spread, which I'm demonstrating very easily, is what do we do throughout the day? I wear glasses. How many times are you touching your face? How many times are you coming close to your eyes? So, sorry, that was just going
So
back
you're
to the
saying
mask.
we should remove our eyeballs?
We should remove our eyeballs. But no, it would have made more sense if he said wear safety glasses or goggles or something like that,
Right.
'cause
Interesting.
right.
All right.
Anyway,
All right.
but
There's so many topics we're mentioning here that I want to explore. While we're on the topic of COVID, through the heat of COVID, I was doing my homework in a way I don't like reading, and I was reading a lot, and I was really doing my research, and I was muckracking, and then later on I found people such as Stephen the Wonder Boy non-scientist. I found Alex Epstein. I found some like really good sources, and then already and Zero Hedge I refound. They had great coverage, and I didn't have to do quite as much muckracking as I did at the beginning when it was just like, this is fascinating. I know that they're lying to us. I have not been following the story of vaccine injuries or basically reduced immunity because of the new technology, or really I've just kind of it's less into the world, and it's less kind of the daily news of whether or not they're forcing me to get the vaccine, and the lies, and keeping us from going to jobs and living our lives, and all the tragic mistakes that they've made. And I guess I was always kind of aware of the fact that it's going to take some time to look at the large actuary numbers to see what the impact on this actually is. I'm curious because you do have a practice. You got people who are coming in and out, and I'm sure you probably have to be a little bit more aware of the trends as I do because I don't have to treat anybody ever. So I'm curious, what now it's what 2 years since we were kind of ramping up on vaccines and boostings and whatnot. What are you seeing in your practice slash just like the general medical literature at this point?
in terms of vaccine injuries,
Yeah, vaccine injuries or like reduced general immunity from people that had it. Whether or not long COVID is actually a real thing, or if that's just people dealing with depression, or if long COVID is something that actually happened from getting COVID, or if it's some sort of a reduced immunity vaccine injury. I guess these are all kind of top of the mind questions on that specific topic.
so in terms of so I have about 2,000 different patients, so my sample size is small. But as far as I know, um, in terms of the patients I have had no known patients that have gotten the vaccine and have had an injury. That being said, we live a little bit rural, so I would wager that uh, probably 75% of my patients didn't get the vaccine.
Nice.
So my sample is a little bit low. What do you see out there? I mean, from you hear stories and things like that, and so I think one of the biggest concerns with the vaccine was sort of like a pericarditis or a myocarditis. Now, So I think that does exist, and I think that's probably a plausible. Can you still hear me? You froze up a little bit.
Yeah, no, I can hear you. I'm listening. You got my focus, doctor.
Okay, gotcha. But the interesting thing, whether it's COVID or anything else, any virus can almost any virus that you get can cause like a myocarditis or a pericarditis, and so you can get. I've heard of reports of that being like sort of the major thing in terms of vaccine injuries. I'm sure there's probably some others, um, and that are out there. It's just in my patient population, I haven't heard of many, but again, not many of my patients got it.
So then what
Um,
about I've seen just kind of fleeting headlines on this, but once again, I'm not researching this as vigorously as I did during COVID, that overall death rates are still elevated, even though we're clearly past the pandemic time of COVID. And then also, I think generally speaking, I've just seen articles about I guess increased cancer and in younger people that they didn't expect it. But I haven't even seen that many. I'm really just talking Twitter headlines that I've seen. So I'm curious. Is there any? I don't know. Is there any? Has that been measured in any way, or is that just kind of loose headlines that I'm just seeing?
I mean, I'm sure there's still probably some fallout in terms of increased death rates. Could it be from COVID? Could it be from the vaccine? Probably both of those, but some of it certainly probably is because of missed screening tests or just in general. I think there's a lack of trust in the medical system, right? So, are more people dying because they're just not going to the doctor for things they would have gone to prior to COVID? Um, and so I think the thing that I'm most frustrated with or most angry about, and I think I've heard both. I think I've heard you say this as well as other people. Is it's just sort of um, I think one of the things, especially if you're dealing with a family doc or an internist or a pediatrician, you have to have a level of trust. You have to trust that what you're saying to the patient and what the patient has to trust you as their doctor. And I just think in general that's gone down. And because that's gone down, I think people probably are a little more hesitant maybe to do something or take something. So even in patients that I have that have like say diabetes who might need insulin, they're like, oh no, I'm not taking insulin for that. And so I think all of this is um, possibly could be explaining some of those increase in deaths.
I will say not only do I fall into that category, I perpetuate that problem because well, actually, luckily, I'm in a slightly different point because I have access to you. And honestly, if I saw a doctor tomorrow and he told me I had to take something, I would call you and I would say, "Hey, is this something I can be?" And then I would sit down and do my own homework, which is something I would not have done 2 years ago. And just generally speaking, I'm reluctant to see a doctor or get health care, which is in part, and this is not anything to do with you or your practice, but bad billing practices I've seen in some of the instances where I've sought healthcare that have just made me reluctant to go down the circle of tests that don't really have solutions but do have bills. So I've made jokes about this. I've talked about it on my podcast, and I've definitely. I guess I guess I got to take some ownership and responsibility for my own actions of perpetuating. Hey, just I don't know. Light some cloves in your house and hope for the best.
I mean, I think it's always good to have to find someone. I mean, I would say that everybody should have a physician they could trust and shop around and get a good feeling. And I like I said, I have a bunch of families who are into alternative healthcare, and even if some of that, and that's a whole other ball of wax. So some of the stuff that's in quote unquote alternative medicine is excellent, some is not. Just like in regular medicine, right? So everything has risks and benefits, and just having somebody you can look through, like, hey, I heard about this herb. Is this going to work? And I can say, even if I don't know it, I'll look it up and say, maybe not that, or yeah, this one's okay, because there
All
are
right.
certain, yeah, like there's a good treatment like red yeast rice. A lot of people use that for high cholesterol instead of taking a statin, and it actually acts like a statin in your body. So for some people, that's a good alternative because they feel it gives less side effects or it's more natural.
All right.
But
So while we're on the topic of alternative medicine, vaccines have been all the rage. You know, prior to COVID, if you told me, "Hey, I'm not getting a vaccine," I would mostly think you were an idiot. Now it's not a topic that I'd researched prior to COVID, but to me, hook, line, and sinker. Heard the stories of in school about the invention of vaccines and how great it's been for humanity. I don't have a kid. I've never experienced them being in a hospital and getting poked with countless vaccines before they can even leave for sexually transmitted diseases where you're like, I don't think anyone's trying to have sex with my baby. I don't know why this needs to get this within the 24 hours of it being alive. Just on the topic of vaccines, I'm not going to say that the technology is good or bad. That's ridiculous. I don't think you can dismiss the technology outright. I'm curious, though, let's start here. Are there some vaccines that you're like, these are 100% good and should be in the category of everyone should get these and there's no reason not to? Like, is there almost like a bell curve of that you can, like, let's just say there's 30 shots that they recommend for kids, that there's 10 that you could say, hey, these are absolutely safe and you'd be foolish not to get them. There's these 10 which, like, I don't know why you wouldn't get them, and then you got these 10 which I don't know why they included this in the childhood vaccine schedule. Or do you kind of look at the whole bunch and go, hey, this is good medical practice that everyone's getting it, and the technology is overwhelmingly safe. Another topic I haven't delved into all that much. I hope to have kids one day, and I don't look forward to having to research that or decide if I have to send them to Jewish schools. These are things I don't want to have to actually think about. So I'm curious, like, of the vaccines that they give to kids, what's your general takeaway?
So, in general, I think there's several important ones before the age of 1, right? And so, one of the scary things that can happen to kids before the age of 1 is their immune system early isn't that great. It's better if they're breastfed, but that doesn't mean that if you don't breastfeed your child, you're a bad person. I was a bottle baby, so I survived. But breast milk does confer some immunity to children, so there's some protection from breastfed babies. But in terms of the meningitis, like there's different types. There's meningococcal, the pneumococcal bacteria can cause a meningitis, and then there's a couple others. So the vaccines that prevent that, I think, are probably higher on my list of things that the child should get and have some proven efficacy. So if I have a patient that comes in that's questioning what vaccines to get or what not, I'll go through each of them with the person, depending on, some people come in and said, yeah, give me them all. And then some people like, okay, well, do we really have to have this one? So in terms of the ones that I'm like, they probably really don't need that at birth. You brought up hepatitis B is, I think, what you were referring to, and you were talking
I
about
heard a comedian talking about that. I forget who it was, but they were like, first 24 hours, what's this for? Who's sleeping with my kid? And I was like, yeah, that seems quite crazy.
Right. Yeah. And hepatitis B can pass through other means, but yeah, I mean, I don't think that's as important as an infant to get. Hepatitis A is another one. And then there's a rotavirus vaccine. Rotaviruses can cause severe diarrhea. And
That's just
can
life, though. They might as well get used to that as a kid.
yeah, it can be, but it can be severe enough in an infant because an infant, if they get dehydrated, it's a much bigger worry. So an infant with the diarrhea is a difficult, more life-threatening issue than an adult with diarrhea. So,
All right, and then does it make a difference with the vaccines, though? I guess in the potential, let's just say that vaccines could cause injury. Does delaying them to later in life, like, does it make a difference if you give a vaccine to a 1 day old versus a 3-year-old in terms of the way that they react to it, or it's like if they're gonna have a bad reaction, it doesn't matter?
man, that's a tough question. I guess um, I don't necessarily know that there would be or know of any research that definitively says like waiting makes a difference. Some people will argue, well, the baby or the child will have a better immune response when they're older, but there's a couple for sure that if you're going to get, you don't want to wait till later in life to get. So one of them is chicken pox. So I have a lot of families who just don't do the chicken pox because most of the time it doesn't. Can it cause serious problems? Yes, but some families just want to get naturally. But the problem with chicken pox is if you get chicken pox as a young adult or as an adult, it can be severe enough that that you end up in the hospital with it, and it can be life threatening if you've never had it. So if usually what I tell parents, if you want to skip the chicken pox, that's fine. But if your kid hasn't had it by the time they're a teenager, you probably ought to think about getting it.
So on that note of a similar binary question is that I think sometimes you got to think about things by the numbers, the statistics, and be a little bit rational about it. So I understand, you might think, hey, why am I bringing my 2-year-old in and let's just say getting 26 vaccines at the same time? But medically, I don't know. It might make no difference. Like, does it make a difference if if you're giving them a bunch of things at birth that you might have a negative reaction because you compounded too many within too short of a time frame? Or is it just if you're going to have a alert, or it could just be like as a theoretical, let's just say 1 in every 10 million kids has a bad reaction to X vaccine, right? So then they were going to have a bad reaction to X vaccine. It doesn't matter if I clustered together 14 of them. It just happens to be that this is the 1 in 10 million people that's going to have a bad reaction to X vaccine. So I guess I'm curious if it's that if I guess the clustering of it or the age at which you get it makes a difference, or if it's just there's going to be the occasional extreme, or I don't even, maybe it's not even that extreme. Maybe it's more commonplace, like with some vaccines, autism or whatever. I once again have not researched this at all. These are just kind of the questions that come to my head in terms of breaking down, or the things that if I were starting to research it, I guess I would be delving into.
So in terms of that, one common side effect, a lot of times there's a couple injuries anytime you're giving vaccines. You froze up, but can you hear me still?
No, I'm still here. I'm listening.
Okay, good,
Me. You
good.
got me. I'm focused.
All right, good. No, you were froze like this. It was
Oh,
strange.
okay.
But maybe my computer's looks lacking. But yes, so typical. There is, and I'm blanking on the name of it now. But there is a combination vaccine that's got a higher risk of seizure if you would give it before the age of 1. So usually you don't get that vaccine before age of 1. Uh, all vaccines have potential side effects. Anytime you put a needle in your body, there's a risk of infection. It hurts. The baby will cry, and then there's also sometimes a risk of seizures. Now, in infants, whether it's the vaccine that's causing the seizure or because they had a fever, because there's also infants younger than the age of 1 or 3, it goes longer, can get what are called febrile seizures, which they are prone to develop a seizure when they have a fever. So those are always things to look out for. Could it possibly be that stacking these vaccines leads to a greater incidence? Possibly. And so I think from what I can understand, the reason why all of them are given at once is, one, to make sure they get them. And certain ones, like I said, so before the age of 1, the risk of meningitis is higher because of the way the baby's immune system is. So do you want to get all those vaccines that prevent meningitis in before the age of 1, because afterwards the risk is still there for meningitis, but it's not as great before the age of 1. Versus like Hep A and Hep B, the kid's probably not going to get Hep A or Hep B. All right, so it's less likely, and usually less deadly, whereas meningitis is very deadly. So those are sort of the conversations that I'll have with parents who have questions as to, okay, well, why am I doing this? Why am I not doing that?
All right, last 2 questions, then we'll move on from the vaccines. But
Right.
I think I'd ask this one, but to clarify, is there anyone that's on the Dr. Crimm, hey, there's no reason to get that list? Like, or that you actually think are problematic? That, like, if you have a patient in your office, you're like, yeah, I'm not advising people to get that one? Or there's none of the current protocol that's that alarming to you?
I mean, I
If you can't
don't.
answer it on air, that's fine. You can plead the fifth.
I don't usually recommend the COVID vaccine for any child under the age of 18.
Fair
Uh,
enough.
yeah.
And then I think I had one other vaccine related question, but I don't remember it. So let's move on to the next topic, which is, I guess when it comes to diet and exercise, I'm lucky. I've incorporated exercise into my life. And for me, I just got to make one simple change, which is I can choose not to eat cake and cookies. And there's been times in my life when I've been very good about that. I'm a compulsive person. I spent some time in my life drinking a lot, smoking a lot. I've had different addictions at different points in time. And at the moment, cake and cookies, they've made a royal comeback. And I've got different tools in my belt to try and limit the consumption. But so I'm just saying, like, I don't need to make for myself. I don't need to make drastic health improvements. I could probably drink a little bit less when I'm on the road on the weekends, and if I choose to be healthy, I can knock out cake and carbs, and from there I could get fancier if I were to so choose to do so. I'm curious, because like a lot of times people go nuts about how bad the processed foods are for us, or how much nutrition has changed, even amongst, like, if you think you're eating healthier foods because of, like, factory farming, or you think you're eating like trail mix and that's healthy and it's filled with seed oils. Are there any things, because like in my head I'm like, all right, I need to take the first step, which is just not eating cake. I don't need to have a conversation with you about seed oils while I'm eating donuts in the afternoon. That's a stupid conversation. I already know what I have to do, which is not eat the donuts in the afternoon. Maybe if I get that down, we can start talking about seed oils and whether or not organic fruit is better than what I'm getting at grade A, or grass-fed beef is better than, you know what I mean? It's like I'm not at that level of sophistication yet in making considerations about my diet. But I am curious if there's any, like, chemicals in our food that you think, like, if you can, you should just, like, fine, so you don't eat healthy, but like never eat a hot dog, it's got nitrates in it, or like, yeah, if you're eating this, that's fine, but just make sure never see, like, I don't know, is there any, like, things that you've noticed in the food that you think is a two-part question, particularly flagrant, or things that you think are particularly good to include in your diet because you might find them to be more satiating and that it's easier to I guess curb, like, I've started eating like more eggs in the morning, and I find that I'm less of a fat fuck because I'm just not as, like, totally starving in the afternoon. So I hand it back to you. Any, like, particular chemicals where you're like, that's true, seed oils are really bad and you should be aware of it, or like, or is that kind of level 2 nutrition that's probably not relevant to most people like me that could just make the easier changes, like not having soda?
Um, so I would say that in terms, not necessarily chemicals, but in terms of stuff you're eating, you want to try and avoid things that come prepackaged, because not so much the seed oils. I kind of, I don't know, like, if oil's oil, my son will disagree with me, but I don't get overly excited about that. But more like the trans fats that you find in stuff uh, that are in packages or ready-made stuff. I think that is probably one of the things that, if you can avoid doing that, that's what I would
So
recommend.
if you've got the budget for bakery cake, just eat bakery cake over Hostess, and that would
Yes.
make a actual improvement in your health.
Yeah, or make the cake yourself, Robbie.
Yeah, that's what I need, a wife who makes cake, and then problem solved. That's all I really got to do. All right,
Yeah.
speaking on the topic of cake, I'm working on a joke now that I don't like Ozempic and that it's making some of my relatives less fat because that puts pressure on me. Like, I like being a medium. You know what I mean? I like being in a society where you had big hefty people giving cover to us medium people, because then we could showcase our medium amount of discipline. But if all of a sudden all these Ozempic people become the skinny people, and then the medium people, we look like the undisciplined ones, and it's like, yeah, that's because all of you guys are, taking the Ozempics. I'm curious. To me, for some people, I'm going to guess Ozempic's a little bit like being in the risk category with COVID, that if you are carrying an extra 100 pounds of weight and you're over the age of 65 and you've never in your entire life figured out how to lose that weight, and now you've got this thing and you're not in the 5% with leaky gut or whatever in the first 3 months and you're losing the weight, it's probably a good drug for you. I would venture to guess for most other people, figure it out. You don't want to be on this thing long term. I'm curious if it's something that you're prescribing to your patients, or if you foresee in like 4 or 5 years from now people that have been on this, like I don't know how long the testing period was. I have no idea, but like we've seen Chantix, for example, which was like an anti-smoking thing. It's not unheard of for drugs to come to market that we later find out have a problem. So what's your general take on Ozempic?
So my general take on it is pretty much what you said. I think it's a risk reward thing. I think so. When you're looking at the BMI, which in itself can be controversial, but if you come in, so like a normal BMI is, let's say, like 21 to 25, around that range. Um, and if you have a BMI, let's say, of 28, probably it's not a good idea to use Ozempic to lose those last 10, 15 pounds. Now, if you have the BMI of 50, right, that causes a whole different category of systems, because a lot of times the people who have a BMI of 51, they're not going to be able to exercise because they can't move. You're talking about 400, 500 plus pounds. They're going to have difficulty moving. They're also going to have difficulty breathing. They're also get more hypercoagulable, which means they're more likely to have blood clots, had blood clots, which can also damage the heart, damage the lungs, damage the kidneys. So for them, getting on a medicine like that they can help them sort of lose that weight, at least get them started, probably is the right thing. And then you have the big class of people that are in the middle, right? So like a BMI of from, let's say, 30 to 45. So looking at that class of people, like the closer you get to less than 30, maybe the less the reward, or the higher, maybe the higher risk and less the reward, versus like 35 and up. It's probably better, because carrying that extra weight, and the more you carry, causes heart damage, liver damage, all kinds of stuff. So more
So
likely with diabetes, all that.
on the actual drug of Ozempic, so I guess from what I understand was it was at first a diabetes medication, and then they
Yes.
found out that it was really turning off people's appetites. And
Yeah.
this is something I can understand. They describe it as the hum, which I understand. That like sometimes you're just especially I find once you start eating sugar, you get that fatigue it's almost like drinking. If you're drinking in the evening and you think you're just gonna have the one wit or whatever it is, it usually doesn't go that way. It's because you kind of opened up that door and then you get the crash on the backside. You want to be going back up, so you just kind of start craving it.
Mhm.
What is it in Ozempic? I think they call it the GABA receptors or whatever, but what is it that it seems to turn off? Or firstly, it seems to certainly turn off the overeating thing. I've witnessed that people that would have eaten 4 plates of food or can still actually. It's odd almost to see people eat like normal people where they can still eat the unhealthy. Like I've hung out with skinny people. It drives me nuts where it's like they eat the most unhealthy things, but it's like they
And
just
stay
somehow
skinny.
don't eat that much of it. And they don't eat that many meals a day. It's like they'll have one meal a day where it's like they're eating the cheeseburger, a milkshake, and the fries, but they don't quite finish it all. And then they're not eating again till like the next day. I'm not even saying that's the healthiest approach, but like it drives me nuts to watch skinny people just eat unhealthy thing and like it just doesn't seem to be an issue for them in the same way. So I guess I'm curious it's another two-part question of what is it in the technology of Ozempic that just seems to, it doesn't even, it's not even like it seems to turn people anorexic. It just seems to turn them normal, where like they just seem to have like more normal eating habits. And is there something that you think they might find down the line that replicates that like in a different way? You know what I mean? It almost seems like they solved the God problem here of like, why am I compelled to kill myself with food?
So why does it work the way it works?
Yeah, and is there a safer way down the line that they might be able to replicate that?
Man, is there? Could there be a safer way? Sure. How? I'm not sure. I think some of it certainly is psychological. So if they could figure out the triggers and come up with a way to sort of block that psychological response, that would probably be a way to do it. And some medicines we already use for weight loss that target more on the psychological aspect. One is Wellbutrin, can be a weight loss medicine, and that's an antidepressant. It's a SNRI, so it targets the serotonin and norepinephrine receptors and sort of blocks them, or like stimulates them, so you're releasing more serotonin and norepinephrine. And for some people, that causes satiety. They're actually using naloxone, which is oh my god, I'm a blanket on the spot. It's basically what you give to like patients with heroin overdoses, and so naloxone blocks the mu receptor, I believe, which sort of blocks that opioid response. And I'm not entirely sure why that works. I haven't used that a lot for that purpose, but it is a choice out there. And then there are several others. For Ozempic, how that works is it's a GLP-1 receptor agonist. So it decreases this what's called glucagon release from the alpha cells in the pancreas. And then it somewhat increases the secretion of insulin granules from the beta cells. There's different types of cells in your pancreas. And through that, one, it drives the extra sugar in your blood sort of inward, but the increase in glucagon is, I think, what they think sort of down regulates that appetite drive. Or that.
All right, and then this one's from
Does that make
Steve.
any sense? That's a lot of technical jargon.
No, that's all right. This comes from Stephen the Wonder Boy, non-scientist. He's obsessed with that other the old school diabetes medication. I can't remember the name of it right now. He's mentioned it. No. He's mentioned it 1,000 times on the Metformin. He loves Metformin. He thinks it's got anti-aging properties. If you're eating an unhealthy diet, it can help your body, I guess, absorb nutrients and dismiss the sugar. And I was like, I'm not taking medication on a daily basis. And then he was like, you should take berberine. He was like, it's more expensive, but it's a natural supplement and it kind of does the same thing. Is there any truth to that? If you're not giving up the sugar, is there benefit to taking a metformin or like a berberine, or is that just be careful? By the way, Steven I think still listens to the show, and he's feisty when people criticize metformin.
Oh, I actually don't have much to criticize. I think metformin's a very, very, very old drug. It's been around a while, and so there are certain times when you wouldn't necessarily use it. So if certain things are going on in your body, certain underlying medical conditions. But in terms of a diabetes medicine, it's excellent. In terms of its anti-aging properties, I think there is some interesting research and studies being done as to say yes, definitively. Hard to say. I do have some people. One of the things that we use metformin in where I do see weight loss is in women who have what's called PCOS, or polycystic ovarian syndrome. And that's a condition where they get multiple cysts on their ovaries. Usually the women are heavier. There's other things that go on, and they really have trouble getting pregnant because of all these cysts that are on the ovaries and the release of the ovum. But when you put patients who have PCOS on metformin, generally they lose weight and their cycles become more regular. And it's one of the medications they use for women with this condition that they can get pregnant on. So I do think there is definitely multiple uses for metformin. I think it is a generally safe medicine to take. One of the biggest side effects with it is diarrhea. And for some patients, they just can't tolerate it and they'll stop it because of the diarrhea.
I also, this is the problem though of the way I consume the news and the way I remember information is sometimes I can't differentiate the things I've researched from scattered headlines. But I remember seeing once a headline that if you're a male looking to have children, for the time period that you're looking to have children, it can ruin your swimmers. I think it can actually cause problems in the tails of your swimmers, which might be because I think
it's
maybe
possible.
I have that wrong.
I can neither confirm nor deny it's possible, but I have not heard that.
All right, and then berberine. if you can afford it, it's not that expensive. I think you could spend $30 a month and take a berberine pill a day if you so wanted to. Any benefits to that, or if you're not a diabetic, you probably don't need to regulate your sugar.
I've heard of berberine, but not enough to make a comment on it. I really haven't read any of that. That's sort of had one patient bring it up, and I looked it up and went over it, and they continue to take it and seem to be okay. But that's a patient of one, and that
Right.
was probably a year ago. So, I mean, I'm always happy to read and learn things. I remember when I read it, I wasn't over impressed, but at the same time, I didn't think it was going to cause harm either. So,
All right, I got two more for you. I'm working on this as a joke, and I haven't quite cracked it or dug in yet, but it's actually on the theme of what I was stating earlier, which is me perpetuating that you can't trust doctors, and I will continue to work on this joke. But one of I guess two things that I found alarming over this past year was, firstly, you definitely had COVID, which introduced a lot of us to, hey, I don't necessarily think that the health agencies or the centralized health agencies are necessarily making decisions that are in my best interest. I think the food pyramid itself is probably another example of that. And then I saw this really wild one. Well, firstly, I think in trans healthcare for kids, I think that also becomes alarming to people of like, wait a second, if you're making that recommendation and this is standard health protocol, like what other recommendations exist on the books that, are servicing some kind of an agenda? And then this is kind of my intro into it. There was this article talking about the drug that they can give to men so that they're able to breastfeed, and they were claiming that it's just as good as regular breast milk, in an article that also said that you can pass the chemical onto your kids, which self defeats the claim that it's clearly not the same. Like you've already admitted it's clearly not as good. There's no one with regular tip milk that's passing on that chemical to their kids, so it's clearly not as good. I guess my question is, I don't know, what other like kind of alarming cases do you see of just bad information coming to us by way of standard like health protocols? Because those are kind of some of the flagrant examples that I've seen. But like I also have seen like a lot of journals having to start retract articles because of AI realizing how much plagiarism existed. Or if you're not totally into the global warming hoax, it's easy to see scientists who are willing to oversell that for some kind of an agenda, which are all the things as a general, news consumer, information consumer, you go, well, who the hell are these people running these, science journals or otherwise? And are they trustworthy? So I'm curious, because you actually work in the field. Like, I don't know, do you come across like recommendations sometimes or standard protocol where you're just like, this is nonsense?
yeah, yes. So there's definitely some things that I think are kind of silly, and some.
Ooh, the doctor froze up. I'm sure he'll be back. That's what happens. You live out in the woods, mountain man, servicing the people of Pennsylvania, out on your farm. He might still be talking, thinking, this is what happens when you do the show live, everybody. It happens sometimes when we're doing part of the problem, but we're not live, so you get to edit out these moments. So while we wait for Dr. Crimm to make his comeback, let's take a look. We got some comments here. We've got Eddie Grimm, avoid sugars for a few weeks and you lose your appetite for it. I know. I've even had where, you just offer for a week and you're like, I'm good. And then you just make the mistake. Cookies, they speak to you if you're a fat person. Eric Shaver, there's no way Dave believes half of what he espouses. I don't think that's true at all. I think Dave is rather good at expressing his opinions, and he's got no reason to express perspectives that he doesn't believe in. And then he's got me there. If he says something I think's not true, every once in a while I call him out on it. I go, hey, I don't think that checks out. And then, it's the natural check of the two Jews arguing things. Is there a specific topic, Mr. Shaver, that you think that Dave Smith is expressing an opinion that he doesn't believe? I mean, you could say, hey, I think Dave's wrong on something. But I don't think I've yet to sit on the show and hear Dave say something and me go, hey, I don't even think you think that. All right, Dr. Crimm is back. Internet connections happens all the time, no big deal. All right. I think you were telling us of some standard protocols that you take a look at and go, this is nonsense.
Yeah. So like, um, there's a lot of stuff that happens in medicine that we do just because somebody somewhere thought it was a good idea, right? And so, um, one of those things would be how often and how early we do certain screening tests, right? And um, one of the things that drives me nuts is how much fear uh, is put into people, like, oh, if you don't get this, you're going to die of cancer. If you don't get this study, you're going to die of this or die of that. And so I think that uh, driving a patient to do a test or get a study based on fear is not the right way to do it. And so, in terms of actual protocols, um, there is so much debate in the literature on certain things. So, like, one is mammograms. How often should you get them? When should you start getting them? And so, different societies will say different things. So, the American College of Gynecology, each specialty has its own sort of board, and those boards sort of do their investigations and make the rules for that. Another one would be prostate cancer. Like, how often do you screen for it? Should you screen for it? Do you need to screen for it? And so again, everybody probably has someone they know or a friend or someone who's had prostate cancer. And so if you had or it's someone close to you, you're much more likely, one, if you're a doctor and have had that experience, you're going to be more likely to say, hey, you need to do this. But the actual data behind doing a PSA or doing a prostate exam, it's mixed. Now, if I was a
Well,
urologist, I would say you'd had to go and get that done.
all right. Let me pivot the question this way.
All right.
As a libertarian, it's easy to look at licensing laws and regulations and go, hey, I think there's profiteering here. And I think sometimes it can be more obvious, at least on the on the shrink side, with the way that they'll prescribe, medications for mental illness. And sometimes, like I saw it with the Ritalin and the Adderalls, it's a checklist system. And Shire's trying to get less things that you have to check off on that list for a doctor to be able to give you the medications, because they're in the drug sale game, and that's the way that works. Or, for example, in treating kids with puberty blockers or otherwise, do you find by and large, like, I guess the standard protocol that the boards will come up with for, hey, here's how we're supposed to be treating people, like, by and large, the procedure is good? Or, like, for example, I remember reading at one point, the recommendations to get colonoscopies turned out to be overstated because I guess the accuracy of screening and prevention was not that high, especially when compared to just sending a shit sample in the mail to the poop people that like to check your poop. So I'm curious with that said, like, do you find, if you're a consumer like me, and I understand, you could see a doctor and the guy's an expert, and, more often than not, you might have an easily solvable problem, and you might as well go see someone. But do you find, like, a lot of the just board certified recommendation standard cookie cutter thing, is not necessarily in your interest and is more for profiteering, such as shoulder surgery? Hey, man, I think you should go get some shoulder surgery versus, letting something heal on its own.
I think there, I think in general, most of the recommendations or the things that they're trying to do, at least in family medicine, is pretty up to date. Now, the problem where I see is more. Let me think how to phrase. So one of the things that sort of drives me nuts is not just in medicine, is but well, it's in medicine. But let's say, have you ever heard of those Lifeline screenings? Do you know what they are? They come
No, I don't
around.
think so. No.
All right. Well, they go to a lot of churches or to like different clubs where people get older, and they'll do like carotid ultrasounds or an abdominal ultrasound. So for a screening test to be accurate, it has to meet certain criteria. One, it has to be very specific and sensitive. Hopefully both, although it's hard to get both of those to find the actual condition that you're looking for. So it has to be accurate and no false positive, no false negatives. Another thing is then, all right, so now you found this, are you able to do something about it, right? So there's different types. Primary prevention means you do something before you get the disease. Secondary prevention is preventing it from getting worse or treating it, right? And then there's tertiary and quaternary prevent. It's a bunch of stuff, but regardless. So those lifeline screenings, they'll come around and do like these carotid ultrasounds or bone density scans in people who don't meet the criteria. So they find disease, or let's say we'll do a mammogram in like a 20-year-old. Now, if the patient comes in and has a mass and you feel a mass, okay, that's one thing. But if you're just doing a mammogram in a 20-year-old or a 30-year-old, you're going to get so many false positives, and the likelihood that what you do to treat that problem or diagnose that problem or is going to cause more harm than prevention. So yes. So, and there's been some drive. You'll see like the lifeline screenings make me nuts. But another one, there's like these, they call them the executive physicals, right? So you'll come in, you're having no symptoms, and they'll do all this blood work and all this EKG. Well, the likelihood you're going to find something is pretty high. The likelihood that something you find was actually something that's going to hurt you is exquisitely low. So, but I think I sent you that article and sort of what I said, and it's I find this in politics too, or with the global warming, like you create this state of fear, like, oh my God, Robbie, have you heard about the albino mosquitoes? And you're like, no, what's the albino mosquito? Like, you don't know. You can't see them. They don't make any noise, and they're going to bite you in the middle of the night. And if you don't take this special drug or pill or whatever I say you have to take, you're going to die. And so the people that do that, or if you go to a doctor that presents things like an all or nothing, that bothers me. That bothers me when the people in the profession do it, like with COVID. I think that's one of the things that like you have to. It's like there's got to be some cases. There's never. It's always this or always that.
I find that's one of the tells on lying is when people want to be when people are that definitive about things. Like, I don't know. Even if you listen to me or Dave, opinions are typically pretty nuanced. And you know why they're nuanced? Because the more nuances we put on something, well, firstly, we're actually saying less, and we probably have a higher degree of accuracy. But I feel like, even most medical procedures, even if it's a good idea, if you're talking to an honest doctor, he could probably tell you the percentages or a range and go, listen, there's a chance that your shoulder will be fine. I think you have a better chance of living a normal life in a year if you get the surgery. Here's how long the surgery recovery is going to be. Here's the chance that we do the surgery and it doesn't. It's like they can, you know what I mean? If you get an absolute definitive, you have someone that's probably trying to sell you something.
Yeah, I agree 100% on that. Absolutely, I agree.
Yeah, which was a big tell for me in COVID. Which was, I've worked in phone sales and for products that I didn't love. Or the first phone sale job that I had was for a product I didn't love, and we were selling basically job opportunities to contractors, and I couldn't tell you that every single lead that I gave you was gonna lead to a job, right? Because it wasn't. That's not the way the product worked. You were going to buy leads, you were going to land some, and they were supposed to be priced in a way that, you had every opportunity in the world to land jobs and make money. There were different ways that other people would kind of answer that question to, basically obscure the truth about them. And one of the tools people would use is just to go, the leads work, and just confidently say nothing else. Hey, listener, how do I know? Don't worry, they're good leads. And then just move on. And that's what they did with COVID. Safe and effective. Zero nuance whatsoever. Just no conversation, no ins or outs, just safe and effective. It's like, it just as a general rule, if there is a clear answer that something's good, people will tell you it. You know what I mean? If I have a product that works literally 95% of the time, I could just say, hey, I got this product. It's going to work 95 because I have good data. And then that's a very clear answer. The second you have people that are either like saying something too extreme, such as just safe and effective, or they're trying to do everything to get around giving you a straight answer. Well, I can't tell you this, but I can tell you this. Then you know that you got someone who's lying to you.
Right. And I don't like it. Like, absolutely. And I mean, another tell would be like you said about berberine, right? Like, I could look it up and I can do my own research on it, but I'm not going to say, oh, I know everything about it if I don't know everything about it. It's impossible to know everything in medicine. One of the things that they did, like our first class, like when we walked into Georgetown, they said, all right, here's the medical knowledge you needed to know back in the 1800s. And it was like two textbooks. And then they showed,
Saw off the
right,
arm or don't.
right, yes. And then they showed like the medical wing of the Library of Congress. So there's new studies coming out every single day. And then the other thing you were talking about, finances, and with those studies, like, I don't have time to read unless I'm busy. I have a family. I see patients all day. So the amount of time I get to actually look at a journal or read is maybe 20, 30 minutes a day, right? So being able to keep up on stuff, I do the best I can. And so a lot of it is like, okay, I can look at this and I'm going to read the research in front of the patient with them. So I like doing that because I like, okay, this is what it says or this is what it doesn't say. And it's a learning experience together. And I think sometimes when you meet a provider, doctor, whatever, who is so certain that their magic pill or potion is going to work, and you're like, well, can I try something else first? And they're like, absolutely not. There are some cases where there is an absolutely not, where their alternative might kill them, and maybe, but you should be seeing someone who you can have a discussion with.
All right. I feel like we covered all of my random ass medical questions based on things I've seen in the news. Before I let you go, is there anything else you wanted to let the good listeners of the Run Your Mouth podcast know?
Just keep on listening to Robbie, buy your sheath. And
there you go.
I'm looking forward to seeing it on Porch Tour. I hope to I have family in Bethlehem, so that might work out, man.
There you go. You got the doctor's endorsement for sheath underwear. Use promo code RYM. You get yourself 20% off the greatest underwear that's ever graced the balls of man. All right, hold on. Let's call